All right, hello, Miss Linda. Thank you for agreeing to be in our video today. We have a few questions for you about your care here, and so if you don't mind answering a few of those. Let's start off with, why did you come to our office? What was your story, and what kind of conditions were you struggling with before you came here?
I've had chronic back pain for several years, and Dr. Dave has taken care of me for the last 3 or 4 years and has done a great job. Earlier in this year, I was still having some back problems, and I'd had a couple of falls, and they were pretty severe. In fact, it felt like my tailbone was broken, or it felt like my bone was against bone, and I was in severe pain. I would say probably a 10 plus. I couldn't lie down, I couldn't sit up, and so I had gone to an orthopedic doctor before, and his remedy was surgery. And I decided, I don't think I'm ready for that yet.
Didn't want to do that, no.
I didn't want to do that. So I had been to PT before, about 6 months prior to coming back to Dr. Dave. And I thought, well, he's helped me before. Let me try and see what he can do to help me then. So I've been with him about 2 months, probably, or a little bit longer, and he suggested a new treatment to me. And of that I was very doubtful, but at that point I was ready to do anything.
Well, and just to kind of fill in the viewers who are listening, we had done typical chiropractic care,
Right.
and you were just plateauing. There wasn't much progress.
That is
and
correct.
So we suggested doing the laser therapy as an addition to your chiropractic. What was your thoughts going into that, as far as, did you have any doubts? Were there any?
Oh, yes.
Yeah.
I had doubts, but I did want to avoid surgery, and so I thought, well, it can't hurt, so let me give it a try and see what happens. I was in severe pain and almost in tears as I would come into Dr. Dave's office. So it was pretty severe for me.
Right. And you said we've been treating you now with the laser and the chiropractic therapy for about 2 months, about 8 or 9 weeks.
That's correct.
What's been your experience through that? Has it been, just let us know, how has it been?
Well, when I first started, I really didn't know that this would work, but like I said, this was a last resort before surgery, and I really didn't want anybody going into my spine, especially at my age. So I'm 73, and I didn't want to take any chances with being possibly paralyzed or whatever, so I did give Dr. Dave a chance.
Now, what's your concerns with that? If you're paralyzed, what would that keep you from doing?
That would change my life completely.
Yeah.
I'm very active usually. During this period of time when I was hurt, I was very inactive. I was pretty much restricted to home, and that was not the lifestyle that I had been accustomed to.
Because you still have your father that you're taking care of, you have sisters, and you have other children, grandchildren. You're involved in a lot of different lives.
Exactly.
Okay. And then, you mentioned that you've been doing PT. You've done PT. What other therapies had you been doing, and what was your experience with that?
PT was good up to a point, but after the fall, my physical therapist told me, I really think that you need to go back and see your orthopedic doctor. I think this is more than just a PT matter. So at that point, she sent me to the guy that I had seen before, and that was, his idea was, well, if you hurt enough, come back and I'll do surgery. And I was not ready to do that.
No, I guess not. Okay, so like you said, we've been treating you for about 2 months, 8 weeks, or 8 or 9 weeks. You were at a 9 or 10 out of 10 for pain before you started. How do you feel now after those 8 weeks of therapy? I
feel really good. My pain level is probably down to a 5 now, which is pretty miraculous considering where I was. I don't have as much nerve pain, I don't have as much leg pain, and I'm just grateful that I've had the opportunity to experience this, and it's well worth any money if you're at the critical level.
Yes, and that's kind of one of the last questions I want to ask you. Like you said, you've been doing well. You've been you were at a 9 out of 10, 10 out of 10, and now you're at a 5. You've been able to manage this,
Correct.
and be a part of all your family's lives while you're going through the therapy.
And I might add, without medication.
Yes.
And that's a good thing, because I was on pain pills for a while, and I felt real fuzzy, and I didn't know, I couldn't drive or do anything like that. So during the process, I was on Aleve, and I was on Tylenol, and I was on that like every 4 hours. And now, sometimes I have to remember to take one of those a day. So I'm very happy with the progress.
And it wasn't like night and day experience. It was a gradual kind of shift.
It takes time.
Yeah.
It takes time. The first time I did it, I was like, "Oh, this is burning," but it really doesn't burn. We found out later to use an ice pack.
Right.
And when you use an ice pack, it is not painful at all. And you may, the day after, you may want to take it a little bit easy, or the day of, and then after that, you'll begin to see some real process.
Yeah, that ice pack really did help change a lot.
It really did.
So, yeah, unfortunately, we learned it a little too far into treatment, but that's all right. At least we
learned it.
But yeah, you we'll pause that. A little brief interruption, but we're back. All right, so you had mentioned the money, or the value of it. So I wanted to just go over something with you. You kept a journal of your experience, and you've allowed me to put the content of that journal on our website, correct?
Correct.
Okay. In that journal, you said that how much you were considering surgery, and you had gone a long time considering surgery. And again, kind of your doubts would go from, do I need the surgery? Should I continue with the care? Those kind of things. Did you ever find out how much surgery would cost?
No, I did not. At this point, I'm not really sure. I never checked into it, because in my mind, that was not going to be an option.
Right. And have you ever looked into how effective back surgery is?
Oh, yes.
Okay. Is it 100% effective?
No.
Right. But it is effective for a lot of things, but not for everybody, or not 100% of the time. So it wasn't a sure thing, as most people might think it is. But I'll tell you, most back surgeries can range, depending on what you have going on, between $100,000 to $120,000 for the billed amount of health insurance. Now, of course, health insurance pays some of that. So just for a typical health insurance policy, though, $3,000 deductible, 10, maybe 20. Let's just say 10% copay on that. But your out of pocket might be around $6,000. So for a typical, just a regular laminectomy or discectomy surgery, you're looking at paying about $6,000 out of pocket for that. But I think you also need to factor in that you'll need physical therapy afterwards, the time it would take to do that, your copays for doing physical therapy. Some of those things might also factor in. There's another part that I wanted to mention, is that some of those surgeries, while they fail, you also you run a risk of having infections. You have a lot of other risks from opening up your spine, like you mentioned. After looking at all the variables and how much your out-of-pocket costs were here, just for the laser therapy, it was under $1,000. So kind of comparing that for you, surgery at cost of $6,000 with insurance, with a good insurance policy, versus $1,000 out-of-pocket for chiropractic, or for the laser therapy for 2 months of care. How would you rank that as far as value?
I don't believe there really is any comparison, because I know what's happening when I have the laser therapy. I can feel the process of it. And really, you can't put a price on the laser therapy that I've received.
That's good. And to me, I look at what you've done and how active you are in your family's life, and see that you've been able to be a part of their lives through this therapy. You haven't had to take 3 months off or 2 months off to rehab after surgery, and everybody else is taking care of you. So I think that's very valuable to me, but I see it for you.
It
So,
is too.
is there anything else you'd like to add for the viewers?
Well, I would say before you even consider back surgery, try the laser therapy. I believe it will work for you just like it's worked for me.
All right. Well, thank you very much, Ms.
You're
Linda.
welcome.
We appreciate it.